بسم الله الرحمن الرحيم. بسم الله الرحمن الرحيم. I know my time is too limited, but first I wish to thank, on behalf of Ganna Hospital, our organizers of this conference, represented in Dr. Nagwan. Please welcome Dr. Nagwan. Any success for this is for Dr. Nagwan and Dr. Yasu. Then I will go straight to the point. Hydrosalpinx before IVF, what? First of all, what is hydrosalpinx? Simply, hydrosalpinx is a distally blocked fallopian tube filled with a serous or clear fluid. Then, why hydrosalpinx is harmful in IVF? This is because of three main theories. The first is the embryotoxic properties of the hydrosalpingeal fluid. The second is a decreased endometrial receptivity. And last is mechanical hindrance. Then, hydrosalpinx and IVF, a treatment protocol. First of all, if hydrosalpinx is ultrasound visible before the start, we have one of three options. This is not a sound effect. The first option is laparoscopy. If there is accessible hydrosalpinx, then we will go directly to salpingectomy. If there is extensive adhesions, then we will go for proximal occlusion and distal drainage. But what happens if there is a contraindication to laparoscopy? For example, obesity and adhesions. Then we will go to tubal occlusion by hysteroscopy, which can be done by three mechanisms. The main mechanism is the E-sure. What is the E-sure? It's a spring device for tubal sterilization. It can be inserted in an outpatient setting using paracervical block or even light sedation. There is no controlled studies, but successful placement had happened in 96% of women, tubal occlusion in 98% of women, with pregnancy rate per transfer 38%, while live birth rate per transfer is 28%. Other two options are diathermy and tubal embolization. Here's a problem that may face many gynecologists. Many women doesn't accept the concept of being sterile, doesn't accept the concept of making salpingectomy, or even tubal occlusion using hysteroscope. So if the patient wishes no surgery, then we go for transvaginal aspiration and ovum pickup plus antibiotics. All of these happens if we can see the hydrosalpinx in the stomach. But what happens if we see hydrosalpinx during ovum pickup? Then we will go no other option except transvaginal aspiration and ovum pickup plus antibiotics. I need your full concentration, please. For a case scenario, a female patient, 32 years old, presented with 2 years of secondary infertility. By history, she is gravida 2, para 2, with 2 living. She has a history of previous 2 cesarean sections. Diagnostic workup found normal hormone analysis, except for an elevated titer of chlamydia antibodies. The transvaginal ultrasound reveals this picture, which is highly suggestive, of course, of hydrosalpinx. Then, what's your option? A, salpingectomy using a laparoscope, or transvaginal aspiration antibiotics, conservative treatment, and last, hysteroscopic tubal occlusion. For sure, salpingectomy using a laparoscope is not a preferable option, as she has previous 2 cesarean sections, so there is many adhesions. Transvaginal aspiration and antibiotics is not also a preferable option, except if the patient wishes no surgery. Conservative treatment is not our choice, and our last choice is the hysteroscopic tubal occlusion using E-sure. Thank you, and before I finish, I will thank Professor Dr. Ayman for her help to make this presentation. Thank you.